Welcome to the Men's Health Unscripted podcast with Patrick and Cam,
where we focus on your entire health, mental, physical, spiritual, and emotional to make sure you are good to go every day.
Welcome to the Men's Health Unscripted podcast with Pat and Cam. And today I've got a very special guest, Jen Weaver. She is the host of the My Spoonie Sisters podcast, where she advocates and helps people battling autoimmune disease. So patients, families, everything in between. I think her cause is amazing. And we've never really talked about autoimmune disease on the Men's Health Unscripted podcast before. And I think this is a great opportunity to get a new perspective on an issue that many are faced with. So, Jen, thank you so much for joining us. It's a real pleasure, and I know we're going to get a lot out of this.
Thank you so much for having me.
So, I kind of wanted to get into a little bit about your journey. I was on your podcast. I learned a little bit about you a while back, and you were diagnosed with rheumatoid arthritis. And ultimately, that led you, from what I understand and talking to you before, you kind of felt isolated and alone, didn't know where to go. And so you started the My Spoonie Sisters podcast. Tell me a little bit about that journey and kind of what motivated you outside of maybe the isolation. What motivated you to help others and create a community where people could go to learn more about issues that they or their loved ones are facing?
Yeah. Well, thank you for having me, and I'm excited to share a little bit with listeners. So, when I was first diagnosed, it actually took over a year to get the diagnosis. I began having pain localized just in the knee in the beginning, but by the end of that year, it had moved into other joints. And in that time frame, I was seeing a rheumatologist that really didn't take me seriously. He, on my first appointment, handed me 3 pamphlets and said, "Here you go. I think you have one of these. In the meantime, we're going to start you on to see if that helps with the joint pain and put some weight back on you because you've lost a lot of weight with how awful you've been feeling." And that felt really strange to hear from a doctor. I guess I expected more out of it. I expected more support. But now looking back, I wish I would have been charting more things. And that's one bit of information that I tell others now is make sure you are charting everything. Document it in a notebook, in an app, whatever you need to do. But because of this, I've not only felt alone in my support, but then going home into my real life outside of the doctor, I felt alone and isolated because my friends didn't understand what was going on. Here I am, a married woman in my 30s with 3 children, going to all their sports events, playing outside with them in the yard, and they didn't get it. You know, they see you on a good day and they don't see how you're feeling behind the smile, I guess. And so I started reaching out to other people, and I actually came across a friend of mine. Her name is Chelsea, and she has started a podcast called My Immune System Hates Me. And she started that in 2020 because she felt isolated and alone. She was a performer and a dancer, and she didn't know anyone else out there like her. So I was on her podcast. We grew into this big friendship. But in 2022, she decided to close down her podcast. And in that, I saw where there was going to be a hole in our community. And we already did so much together, all of us Spoonie sisters. We would do reels together and have a lot of fun. And so I decided the podcast needed to be called My Spoonie Sisters. And this was not to leave the men out. We have plenty of men, like I had you on the podcast. You are all included. I don't know what I was thinking when I named the podcast, but it's fine. I want everyone to feel welcome and supported. It's a space where we can come and gather and talk and share so that people don't feel alone.
Sure, that's awesome. And men face autoimmune diseases just as well. I don't think anybody, I didn't feel left out or not welcome when I came on your show. So, you have a very unique insight. I mean, you're a patient, you're an advocate. So, kind of what did you learn about rheumatoid arthritis and autoimmune disease kind of in this process? It seems like in the healthcare system at times, hey, this is your diagnosis and go have fun, can kind of be how it is, right? And so I'm sure you did your own research and tapped into a bunch of resources. I mean, what are some things that you learned about rheumatoid arthritis kind of as you went along, and potentially learning, some factors that help kind of remediate the symptoms, which are various for everybody?
Right off the bat, the one thing that I learned in the beginning is how foolish myself and so many other people are because honestly, we hear the word arthritis and we automatically think of aging old people because that's just what it's been associated with all these years. But that's not exactly what it is. It can be seemingly normal, everyday people that are living with a condition that you just don't even realize they have. And so rheumatoid arthritis is so much more than joints. It attacks the ligaments, it attacks organs. There's just so much more at play, and it can affect anyone at any age. I would go into the infusion room and there would be people across the board, men, women, old people, young people. I would be sitting next to a 9-year old getting infusions. I'd be sitting next to an 80-year old. That's just what it is. And so I guess what I'm saying is I learned that there's more to it than you would ever think.
Sure. It seems extremely complicated. Like, I'm a, healthcare practitioner, and I've definitely had patients that have had rheumatoid arthritis specifically. I've had family, friends, coworkers, and it seems like everybody's solutions are kind of different across the board, right? I've heard of, I had a boss one time who had RA, and he put it into remission, but he eats like super, super clean, and that doesn't always work for everybody either, right? Like, so some people can just, really shore up their diet and everything, and that works. And some people have to take medication and a combination of both. And it must be difficult kind of managing something that is different for everyone. Like, generally, certain diseases kind of have very similar characteristics, but it seems like autoimmune disease, it's kind of all over the board. In your experience being an advocate, what have you seen?
So autoimmune diseases, they are very complex, and there's a few key things that I think everyone should know. So number one, they are often invisible. Just because someone looks fine on the outside, that does not mean they are fighting a battle on the inside. They're not fighting a battle on the inside. Fatigue, pain, and other symptoms, they can be hidden, and they can be hidden really well. And number two is no two journeys are the same. Even people with the same diagnosis can experience very different symptoms and challenges. I've seen people go into remission, and I've seen people fighting it for years. Some people I've even met have just never felt like they've reached remission. Number three, it's a lifelong journey. Autoimmune diseases don't have a cure, but they can be managed. And like you mentioned, they can be managed with our food intake. They can be managed with supplements. They can be managed with different medications. So, like I said, they don't have a cure. The ups and the downs, they're part of the process. So, support and understanding, that's extremely essential. And number four, mental health matters. And I know we say this all the time, but it's true. And living with a chronic illness, it can take a huge toll on your mental health, leading to things like depression, anxiety, and feelings of isolation. And it's important to focus on emotional well-being as much as the physical, because we tend to, I guess, focus more on our physical, and everything else kind of gets ignored. And number five, advocacy is key. So navigating the healthcare system, it can be daunting, and understanding the condition or treatments can make a huge difference for care. And so reach out to anyone and everyone. Google can be your best friend, but it can also be an evil thing as well. Definitely talk to people that are going through it like yourself.
Sure. I mean, I think those are some really great points that anybody, dealing with it, whether it be with a family member or themselves, can take away and kind of implement into their own life. You mentioned something that I really would like to talk about, and it's kind of something that we've established here. And I think that is really important with a lot of different communities that are advocating for different various issues, but specifically the community that you've created with My Spoonie Sisters. I would like to kind of, if you could tell everyone kind of what the spoon concept means. I had to look it up when I first had my first rheumatoid arthritis patient. They explained it to me. I looked it up and then kind of put the pieces to the puzzle together again when I came on your podcast. But what does that concept kind of mean?
Okay, so I'm going to start out by saying this was actually established by Christine Meiser-Dino. I don't actually know what year it was, but she is kind of famous in the autoimmune world. And she was diagnosed with lupus. And she went out to lunch with a friend and she was trying to figure out how to explain to this friend what life was like for her with all these changes that she had going on. And so she reached over, and I've actually got some spoons in my hand. So she reached over and she grabbed as many spoons as she could find within the restaurant and she held them up and she said, "This represents my energy for the day." And so she asked the friend, "Okay, how did you start your day?" And they run through the typical things. And so I'm going to do this with you. So, Patrick, how did you start your day? Say you started with 12 spoons. What did you do first thing when you rolled out of bed?
I rolled out of bed, drank some water, brushed my teeth, and took a shower.
Okay, you just used up 2 spoons to do all that. And
Okay.
now you have 10 left. So, what did you do next?
I went to go see a client and spent probably an hour with them doing healthcare things.
Okay. And depending on that client, and I don't want to sound rude, but how needy they might be,
Right.
sometimes that can take, and especially an emotional toll. So maybe you used another 2 spoons. So you've already used four and you still have the rest of the day to go through. Have you had lunch yet?
Yep.
Okay. You probably used another one for that because maybe you had to make it, maybe you had to walk somewhere, or I don't know what you had to do, but you had to get lunch somehow. And
Right.
so you see, as your day goes on, for people that are chronically ill, sometimes those tasks that seem so easy and minor throughout the day, they've reached lunchtime and they're so exhausted. The fatigue is hitting, and they really feel like they need a nap already just to function and get through the rest of the day. And so that's how the spoon theory was. I wanted to explain to a friend what it was like living the life she had.
It's a great way to kind of put that into perspective because then you have something tangible that you can show someone, right? Like energy is various with people. Pain is, very subjective. Like different aspects of these diseases and other, difficult parts of life can be very subjective for everyone. And I think giving someone a kind of telltale sign like, hey, this is my energy source for the day. I have these 12 spoons. And now there is in this concept, some days, from my understanding, like for my example, getting up, drinking some water, toothbrush, and shower might take 3 spoons or 1 spoon. So the energy requirements are various. So I think people should probably also know that sometimes it's a 4 spoon day just to get in the shower, and sometimes it's a one, right?
Yes, definitely. And I've actually had people reach out to me and ask, what is a typical day of spoons? Do you wake up with the same amount every day? And it's like, no. And we're all different. And one person, maybe they have cancer. And so they're going through treatments and maybe those treatments are heavier than the treatments that I'm going through. So everything that everyone is going through is completely different. And how they're sleeping, what kind of food they're eating, that all goes into play with how much energy they have and how many spoons they have.
I definitely appreciate you kind of laying that out there. And I think it's a good way of people to kind of visualize something that is really, like you said, it can be invisible and can be hard to conceptualize. So, what I did want to move on to is the podcast a little bit and the community that you've created. What has this community done for you as a patient and an advocate?
It's a good question. So, navigating an autoimmune disease can feel isolating, overwhelming, and confusing, especially in the beginning. So, I wanted to create that space where people wouldn't have to feel that way, a community that supports and uplifts the newly diagnosed and beyond. I wanted to build a platform where people could share their stories, their resources, their advice, and whether you're at the start of the chronic illness journey or have been managing it for years, My Spoonie Sisters, it aims to make sure that no one has to walk this path alone. And the podcast is a space to connect, educate, empower each other. But it's turned into so much more. It has turned into an entire community. We have a support group that meets through the Cabana app, and we do that twice a month. And I get so much out of it. I love when people come and tell me how thankful they are for everything that I've created, but it wouldn't be there without everyone joining in and coming along. And they're to me as much as I'm giving to them. It's incredible just to watch all the amazing people come in, and they really do. They want to lift people up and help them not feel alone in what they're going through. I've met incredible people that have started programs like Cards to Warriors, and this is a platform where they send out cards to people. We have volunteers like myself. I joined as a card crew member, and they have a program set up we can look through and see who's maybe going through something. We had someone that was actually on their deathbed, and so we all band together and we sent video cards to this person. We've had people going through cancer treatments and really struggling, and we've sent out cards to them. It's an incredible thing. And so I get more excited the more that I meet more people and the more people want to join in and do for others, because that's really what I think helps make us all feel better in a way is giving of ourselves.
For sure. The community is such a strong um, just aspect, I think, for anything. And I've been doing this podcast for a while, and I've met people who do cancer support groups, and now like you do autoimmune support group, and those support groups are so important. And like I even have a patient who's a pediatric, and the parents are part of. He has a very rare, like 1 in 5,000 genetic disorder, and the parents are part of a support group. And being able to pull people together that are going through the same experience, and it's really interesting because you see a lot of healing that goes on just in the sense of community outside of any type of medical treatment. But then you also see people who come together and say, hey, we found this therapy, or we found this supplement, we found this food, whatever, and it works for us. And maybe people didn't know, right, about these different things. And then it's a way to kind of pull information together, and maybe it doesn't work for everybody. And I think we're so, science and medicine is so pushed on like evidence base and all that kind of stuff, but there is something to anecdotal evidence, right? Like maybe it's not all right, but maybe if you take bits and pieces from the anecdotal evidence, you can kind of put together a plan that works for someone. So is that something that you guys see a lot of, where people will get excited because they found something new that has helped them, and then maybe it can help others?
Definitely. I know that myself, I like to share. Every time I find something amazing that I think is helpful, I want to make a video about it and I want to share it because I want everyone to have it. And within the community, a lot of other people that do that, whether it be an arthritis friendly pen or a pair of shoes that are better with a wider toe box for bunions and arthritis pain. If sometimes it's an ice pack or a heat pack, we get excited. We want to make sure that everyone else knows about it too.
In a way, just sourcing all of that information, I'm sure that you have made people's lives so much easier to manage, and probably contributing to having more spoons to kind of survive the day.
Absolutely. Okay, so I had an idea of something that we could bring up. So when I had you on the podcast, we were talking about your job and what you do for others.
Mm-hmm.
And I want to talk about the importance of that because I think there's a space for that that people are missing or don't even know about. So can you tell us a little bit about that? And then I'll jump in.
Okay, so being on your podcast, Jen, you know that I'm a healthcare advocate and a pharmacist first, healthcare advocate, kind of like 1A, 1B, right? And I've noticed in my practice where I'm helping someone navigate a disease or multiple diseases and their medication and everything that stacks onto this, and helping that, streamline that process is super important, because you're already dealing with the I'm sick and I'm tired and I'm sick and tired of being sick and tired component. I did want to talk a little bit about your work as an advocate. So I'll kind of give you some background on mine for a second. I don't really talk about my job too much on the podcast, so it's kind of funny. But I'll give a perfect example. Yesterday, I went to an appointment with a client. It was a new client. It's a new appointment, and we were discussing some of the medications with their doctor. And at first, the doctor was kind of, curious, like, why is this pharmacist here? And it was just, I could tell that there was a little bit of tension in the room. Like I was asking a lot of thoughtful questions. And, some things happened where it might have gotten a little dicey there. But at the end of the day, now that doctor knows that there is somebody watching this person's back and that they have their best interest. Um, so, with all that being said, how exactly do you advocate? And maybe what are some things that you've seen as an advocate for rheumatoid arthritis and other autoimmune disease?
What it is I want to talk about the importance of what you do and why people need to know more about people like you. And the reason being, when I was first diagnosed, the first few medications that I was put on, I ended up being allergic to. And one of them, I was out of town visiting my parents. I'm out in the middle of nowhere. And I had an allergic reaction causing me to have a seizure and fall and hit my head. And we called my rheumatologist to let them know. My husband did all kinds of research on this medication. And in a rare occasion, some people have seizures on this medication. They continued to argue with me and tell me to continue taking the medication. And at the time, I'm so glad that I had him there to stand up for me and say, no, she's not doing this. We're not doing this. Because otherwise, I would have said, well, that's what the doctor said. I have to do it. But I think if you have someone there to voice the concerns, especially because I have had so many allergic reactions. I had that one. I had another one to an infusion medicine. I found out I'm allergic to TNF inhibitors. And if you can't voice for yourself, it's good to have somebody that has your back and can help talk to your doctor.
So I think it's important to kind of say that, right? Like most people will say, well, that's what my doctor said, and that's fine. I mean, they know, diagnosis and medications, and they kind of follow an algorithm to help, but everybody reacts a little bit differently to medications. And, you had a seizure taking the medication. Um, they're not it's as an advocate, the doc isn't the one taking the drug, right? They're the one prescribing it. And you can know everything that there is to know about a medication, except how it's going to react with the person you just prescribed it to, and how it's going to metabolize in their body and what it's going to do to them. And so it's really easy to say, well, just take it. Yeah, deal with the seizures or whatever, I guess. But like, you're not the person with the seizures. You're not the person that has to go through these things. And I think it is important to have an advocate there to say, just put a hard stop to it. And I think a lot of people get caught in the idea that the healthcare system is almost like jail. Like, no, you have to do what you're supposed to do here. And it's not. I mean, there is freedom of choice and you can say no. That's the beauty of it, right?
Yeah. And I think, being a product of the 80s, I think that when I was growing up, you go to the doctor, they prescribe something because you're sick, and you do as told, and that's it. And I love the fact that now, as I've aged, I've learned that's not really how life works. And if the rheumatologist would have stopped to listen to me, the reason he said to keep taking this medication is he said, well, you're already diagnosed with seizures, so this has nothing to do with the medication. Well, no, like you said, hard stop. I've never had a seizure in my life. The medication that you are talking about, I was given for migraines, but it can also be used for seizures. So sometimes they need to listen to their patient a little better.
Yeah, Cam, you've been out of the retail game for a little bit. Any thoughts on this?
No, I mean, it's a weird balance. So something in school, we always talk about is you sometimes have to, weigh out the risk versus benefits when it comes to medications. Anything that's going to cause any kind of like loss of consciousness, fall, risk, injury, things like that. That's usually a pretty big flag to change the medication, change therapy, because if it makes you, throw up a little bit, or if it makes you have diarrhea, take it with food, you can get past that. But if you're, bust your head open, it's going to be a little bit harder to treat for anything if you're bleeding out. So like it's a weird balance sometimes. Typically, especially when it comes to specialists, rheumatologists being a specialized side of medical doctors, they're not really in tune to their patients as well as they could be. But again, they don't see them as often until things are usually kind of bad. And then they kind of like will flip through the chart a little bit and see that, oh, this medication's there. That's usually for that. And but like you said, a lot of medications do have a lot of crossover, and a lot of people don't realize that. So sometimes when you see a medication and it's advertised on TV, and you're like, oh, this was on TV for bipolar, and they're not taking it for bipolar, and you should not assume that someone has that particular condition. It's actually something similar I ran into, with the VA systems last past week. Got a new primary care physician, and you guys won't quite know as well, but the VA has probably like the most connected medical filing system. It's dated, but you could pull files up from all the other sectors. So coming from the Tampa up here to the Louisville area, different entire area. All the doc would have to do is open them up and kind of read through it. And they had a bunch of my stuff wrong. I don't know where they got some of it from, but they're not taking the time, unfortunately, to do that paperwork, to do that hard research on the patient.
Yeah. And I think I'm sure you see it a lot, Jen, is like that continuity of care going from PCP to rheumatologist, if there's another specialist involved. It's tough. I mean, they can be in the same hospital system and some of them can link up and talk to each other, but how many of them? I mean, I catch it a lot where I think I'm on a 10 out of 10 or 20 out of 20. I have a new patient that has three or more doctors. At least one of those doctors has a crucial piece of information wrong or dated, that's outdated or that didn't get updated or is no longer, something that's prescribed or no longer a disease that we're worried about or something. And you're really opening people up for harm. And I'm not, we're not ever pointing the finger at the doctor. It's kind of part of the system, right? Like the system, there's so much disconnection that it's tough for them. I mean, they have to see so many patients a day. They only have so much staff. I mean, people eventually have to go home, right? But they're the system has gotten so, I think, overstuffed and saturated that it just makes it so difficult for people who do care. I don't think anybody goes to medical school or pharmacy school thinking like, I'm going to be a bad doctor, right? They
Yeah.
go because they want to help. And then what happens is now they are confined to different systems. You have insurance, you have Medicare, and those systems kind of lock them in place and force them to practice a certain way. So this is never like a attempt to, talk badly about a healthcare provider. I mean, I think most of them all get into the space to do good and to, help people.
Absolutely. And I think it's important when a patient finally finds the person that listens to them and takes them seriously, hold on to that doctor or specialist as long as you can. I moved. I live 4 hours away from my rheumatologist, but I kept her because she's amazing and I'm in good hands with her. She listens to all of the rest of my care team because, like you were talking about, a lot of us do have many different specialists. I have a cardiologist, a urologist, the list goes on. And I need them to pay attention to what they're prescribing and look at me as a whole.
I was about to say that's another thing that kind of really flags high for pharmacists in our positions because a lot of times, whether you're getting your medications in a hospital, whether you're going to pick them up at your local pharmacy, there is a level of review that most places will have pharmacists do where they kind of check for that. And I've had instances where this happened before, where two different doctors, one was a cardio, and I can't remember the other guy was, but they were literally across the hall from each other. But they prescribed the same patient an ACE and an ARB. Now, being, for us, we're like, oh, what the hell's going on there? But, there's basically two blood pressure medications that are working on the same system. And that's a big no-no in the world. So it's like weird catches like that, we're supposed to be able to have some kind of system to kind of catch through that. And like Pat was alluding to a little bit, it's like a cliche thing we have in the medical world. We call it the Swiss cheese model, where just things will sometimes fall through each level of cheese through the holes, and then eventually the patient, unfortunately, is always on the downside of that.
It's something that comes up to a lot in the advocacy practice too, where people don't say it so much in these so many words, but this is probably the easiest way to describe it is, you have a patient who goes to see a cardiologist and all they care about is their heart. And they're, for lack of a better term, a lot of people have said, I feel like I'm just a heart sitting on a table. And it kind of goes back to they have a limited amount of time. They have to address what their specialty is. Like there's all these, boxes that they kind of have to check to make sure that they're doing their job. But at the same time, it makes people feel so disconnected because it's not like, oh, hey, Jen, how you doing? It's like, oh, hey, Jen's heart, how are you doing? Right. And they're just addressing that. And most people feel like when they leave a specialist, they don't feel like a whole person. They feel like they're just being looked at as the disease that they have, and then they move on. And that's, I've never been in that situation, but obviously I've advocated for people. I've had family members in that situation, and they leave the doctor like in this, just with this gray cloud over their head. They're sunken, and they have truly had any type of human element stripped from them for that period of time because you're just a heart.
Honestly feel really lucky because the cardiologist that they sent me to, he he's taking everything into account. He listened to all the notes that were sent to him because I am at high risk for a heart attack or stroke because of my rheumatoid arthritis and cholesterol issues. And so I'm glad that they are all working together to take that seriously and to figure out how they can help me the best so that I don't have that happen.
Absolutely.
I guess I had another thought too, is I would say to people, try not to skip around where you go to a pharmacy. Try to stay at the same one for all of your meds as much as possible. I can't do that because I do have a specialty pharmacy where I get one of my medications for my RA, but everything else is all through the same one. And it's going to make your life easier. It's going to make their life easier because I would really rather you look at me as a whole and everything that's prescribed to me to make sure that it's okay for me to be taking.
Yeah, that's like actually a great pharmacist pro tip too, that you brought up. Not only that, but if if you're filling it, if a person's filling it two or three different pharmacies, the pharmacist at pharmacy number one doesn't know what the pharmacist at pharmacy number three is seeing, and they might not even know. And especially if it's out of system, like if one is filling at a CVS and one's at a Walgreens, and they don't talk to each other. So they would never know that you're filling one medication that interacts with another medication at the different store. So they can't help you, right? They can't be your last line of defense between that person and the medication if they are left in the dark about key pieces of information. So it's really, I mean, I think that's a great point, is to try your best to fill at the same place so that you always have it's just about maintaining the continuity of care for as best and as long as you possibly can.
I think also one thing, I've always chimed and harped about is like patient health responsibility. Like as a patient, you need to be responsible for your health as well. Now, I know it's super difficult because there's jargon and stuff, but keeping with this, what we're talking about here with people going to multiple pharmacies, we've actually had instances where people wanted to get a certain thing filled. It was interacting with some of their medications, or it was contraindicated, meaning they cannot take it with this, and they would just go to another pharmacy and get this stuff. And it's like, what? Why in the hell? Like we've told them, like, why would you do this? This is irresponsible on your own behalf. Kind of same thing happened around COVID. I call this the Thanos play. Is like people would go in the beginning of COVID, they would go to the different pharmacies because different pharmacies had the different brands, and they would collect all the brands of vaccine. And it was like, why? Why would you do this? Like, why? What is going on here?
I think it's scary. I mean, it's just as bad as drug seekers, right? In a way, you are drug seeking and just in a different way.
Yeah.
Right. So I did want to know, kind of what are some maybe bright spots in your advocacy? Like, have you had anyone that it's come back and said, man, Jen, like your podcast has really helped me out, or you gave me some advice one time that's changed my life? I mean, maybe one instance, and then just like how did that make you feel as far as your journey battling rheumatoid arthritis, and then like what you've been able to kind of pour back out into the world.
Yeah, so there's been a couple of instances that I can think of, and they're all kind of similar. They all have to do with psoriasis because after my allergic reaction to my TNF inhibitor, it triggered pustular psoriasis, and it's something I have to live with lifelong. And I've actually had people recommend their friends to talk to me because they know that I have tried everything. I know what might help make them feel the best that they can, or I have do's and don'ts and all the fun recommendations. And so there's been two different girls that I can think of that have reached out to me and said, okay, nothing's working. Everything that I put on my skin hurts, it burns. I feel like I'm burning from the inside out. What have you tried? What works? And I tell everyone the same thing. And so if you have psoriasis and you are listening, I like to use Udder Balm. Of all things, you can find it on Amazon. It's super inexpensive. It is the one thing that does not burn, hurt, cause any issues. It's extremely soothing. You can carry it with you, use it all the time. And I have had people mail me gift cards and say thank you. And I mean, all kinds of incredible, sweet messages. It's been amazing. I don't expect those things. I don't want those things. I honestly just want other people to feel better. But I definitely, there's been some people that have made my eyes sweat, and I appreciate the kind words that they've had to say.
For sure. So, man, that's just like awesome because we've had it too where people will reach out or they'll be in our DMs, and there was like a big, I think probably one of our biggest like pushes from our fans and stuff, and we got a lot of new fans from this is like a lot of guys were struggling with relationship help, which I'm not sure where we fall into this line, area, but it happens, I guess. And they were just, and this is like happened like a year and a half or so ago. And it was just like this big push of like, how do I manage my mental health? And my partner will use like some places of vulnerability against me in an argument and things like that. And we were just, we had started talking about mental health. And I guess that just kind of fell in line with what we were doing. What our effort was is like, I don't know, you can set some boundaries and do that kind of stuff. But so we decided to have some like men's relationship experts on and people to kind of answer those questions. And I felt like that was really beneficial. And we did get a lot of really positive feedback as far as like, hey, thanks so much. You like really helped me manage my relationship better. I realized that maybe this person wasn't right for me anymore. Which you never really want to hear, but it happens. And so like all that really great, like positive feedback of like, well, this is an enlightening moment for some men, and even so much so for guys to like reach back out and say thanks for putting so much effort into helping answer those questions.
That's incredible because it's not like most men are willing to do that, right?
Right.
No. I mean, we're seeing a trend in it where people are kind of swinging around into that stuff recently, but yeah, it's still an uphill battle.
Right.
Absolutely.
And we've seen, just like various things. Like it first started out where it's just like, hey, can you help me get better, harder erections, right? Like all the typical things that you think guys think about. Um, and then it kind of started to move into, I think in 2022 is like where we really saw kind of a huge shift where guys were saying, I want to care about my mental health more. I want to know more about my mental health. And there was just a few instances and events that we were at where there was like this huge shift. And I'm like, maybe the light bulb's starting to go off with these guys. And it felt like the work that we were doing was pretty beneficial at that point. Up until then, I was just like, all right, well, we're just kind of educating on health. How do you prevent chronic diseases? All that kind of stuff. And it just that I feel like took it in a whole different direction.
It's fantastic.
So have you ever had any men reach out to you? I know it's tough for guys. I think I want to
Yes.
ask, like, is it's tough for guys to ask for help?
Yes, I've had quite a few men, and I'm very careful about that because, I'm a happily married woman. I don't want people to get the wrong idea. I don't want my husband to think the wrong thing either. So I'm very, very careful about that. But I have, and I've had quite a few men on the podcast as well. And I just try to treat them like I would anybody else. I give them the same advice. I talk to them like a person because they are, they're just a little different. I might not always understand them, but that's okay. And yeah, same thing. It's always about the skin. I don't know why everyone always comes to me about the skin, but they do. And I always give the same recommendations. And my number one, once again, Utter Balm.
Autoimmune is some good stuff. I can't
Ah,
remember if it's like a great aunt or maybe just my aunt. But up in Ohio lives with that stuff all the time. Just loved it.
it's
It is good stuff.
It's amazing. I tried aloe vera, I tried prescriptions from the dermatologist, and everything made my skin feel like it was on fire. And then my brother-in-law of all people, he said, "Hey, I've got or not arthritis, but psoriasis also." And with his work, he works outside. His hands are always cracking and having issues. He said, "This is what helped me." And he gave me a tube. And sure enough, it's the best stuff ever. And even for people with eczema or any kind of hand concerns, it's amazing.
Oh yeah, that's definitely a good little tip. So like keeping in line with some of these tips and tying it back to some RA things, what are some of like the two, top two do's and top two don'ts for those either just, entering this RA space or maybe those who have been in it but haven't really had a direction to go?
Okay, so my top do's, and I tell everyone this, it's extremely important to note everything. I don't care if it's a journal, I don't care if it's your notes in your phone or an app, but you need to be tracking everything that you notice, even if it seems really minor, because they can't help you if they don't know what's going on. If you go into an appointment, even if your family practitioner recommended you see this rheumatologist because of some blood work or something, when you go into that appointment, if you're just kind of saying, oh, well, sometimes my feet or my hips hurt, but you can't tell them if it's in the morning or at night, if it's stabbing, if it's burning, if you can't give that information, how can they help you? I tell even my own daughter this. She is now into the rheumatology world. I somehow blessed her with that experience. And she did the same thing. She went into her first rheumatologist. Well, sometimes this hurts. And you have to track everything. And don't be afraid to talk to people. Reach out to people that are going through things that are similar to you because obviously they're living it and they have the best advice to give to you. So those would be my two do's. My two don'ts is be careful when you're Googling because that can be helpful, but you can also be researching bad material that is false. So you want to look for the reputable uh, organizations out there. So if it's for rheumatology, you might want to be looking at the Rheumatology Research Foundation, AI Arthritis. Same with psoriasis. You want to look for the National Psoriasis Foundation or also AI Arthritis. There are reputable companies that are going to give you all of the information that is correct and can lead you in the correct direction. So that's my first don't. My second don't is try not to not take yourself seriously. You're obviously going through something, and it's time that you take the steps to work through it and find out what's going on. And remember that it's not just a pill that's going to make you feel better. It's work. It's a lot of things. It could be things like implementing a better, healthier diet. It can be exercise. All of those things go into play. And if you want to live your best, healthiest life, you gotta recognize that.
Those
Praise
are
it.
those are some good tips. I got to say, funny story about Dr. Google. Cam, you'll probably laugh at this. I had somebody say, "Hey, I have been helping my husband out with his medications, and I Googled what they're all for, and why is he on 7 blood pressure meds?" And I said, "Sure, I'll take a look at it." They came to the office, and a lot of the drugs that they had Googled, like they said, atorvastatin was for blood pressure. So somewhere on Google, it's telling people that a statin medication, which is typically for cholesterol, was for
Mhm.
blood pressure. And then they also had clopidogrel or Plavix, which is an antiplatelet medication, was also listed for blood pressure. Whether it was their understanding of the information on Google or the incorrect information, sometimes Dr. Google is way off, like could not be further from And then like at that point, you do a little bit of explanation. You're like, well, you're actually not on 7 blood pressure meds. You're on like 4, but here's some answers for you. And it makes a lot more sense from them. So Google can be your friend, but it can also be detrimental. So maybe pull from reliable sources, like Jen said.
And I think even unfortunately for some people, because they don't understand what they're looking at, even if it is correct information, they are misinterpreting it. So like you'll see people who were like, "Oh yeah, this study showed," but that's all they can tell you is what that little like the little summary in the top said. They can't tell you about the population or the actual treatment. So it always has to have a little bit more in-depth understanding and research.
Absolutely. And some of those studies are still in process. Like with the Rheumatology Research Foundation, they have like investigators that are working on these potential positive things that are going to help someone. And they might still be in the beginning stages of it. They might not actually have answers from it yet. And so if you're Googling in the wrong area, you're going to be led down the wrong rabbit hole.
Yep. I think these have all been great points from Jen at the My Spoonie Sisters podcast. Give her a follow. It is really beneficial. I've been on the podcast, so it's great. Just kidding. But no, she really provides a lot of really great information to people about different autoimmune diseases. And she's built like a really great community. So give her a like, give her a follow, and also show your boys some love at the Men's Health Unscripted podcast. Like, follow, subscribe, all that good stuff. Um, Jen, it's been an absolute pleasure having you on. I've learned a lot. I'm an advocate and I still learn. I'm learning every day. And your experience has been um, just very enlightening and kind of helping me. If I have another rheumatoid arthritis patient come through, I think I will implement some of these techniques that I've learned from you in your show.
A good coat hanger for the part of the episode I've seen at least and been a part of is that healthcare is a very muddy field to kind of go through, and it never hurts to have someone around you, either listening in the car or maybe someone to reach out to and talk to help you kind of find your way through that.
Definitely. You never have to do it alone.
Awesome. Well, Jen, you're always welcome on the Men's Health Unscripted podcast. Thank you so much.